Everyone. Good afternoon, everyone, and you're welcome to the webinar, which is hosted by the Healthcare Federation of Nigeria. And our topic today is revealing the untapped potential of cancer care in Nigeria. We have a number of esteemed panelists from both the public sector, including the National Institute for Cancer Research and Treatment, as well as a number of stellar cancer centers within the country, and the president of the Nigerian Cancer Society. I'll be your moderator for the session today, and we could definitely have a great 90 minutes discussing about cancer care and partnerships in Nigeria. Now, just for a quick background, as we allow others to join us, cancer, of course, is a growing concern in Nigeria. We've had a lot of increased incidence rates. And every time you kind of open your social media, you'll see people who are requesting for funds, for support to treat cancer in a relative or something. And you're wondering that, isn't there something that can be done? And I believe that this particular webinar is going to shed a lot of light on how we can explore solutions that can unlock partnerships between the public and private sector in Nigeria. There are a number of very experts, stakeholders, participants, and we're going to discuss issues, share best practices, and foster collaboration. Of course, the goal of the Healthcare Federation of Nigeria for this particular webinar is not just to talk, but to inspire action and positive change. And we believe this will improve cancer care and outcomes for all Nigerians, and by extension, also to Africa. While we're waiting for others to join us, I'll just see the bios of our esteemed panelists to begin to scroll on the screen. So the technical team, could you scroll the bios of our esteemed panelists to begin to scroll? As you can see, we have a number of very esteemed guests here today. Of the Healthcare Federation of Nigeria. And very soon we're going to be hearing from the president of the Healthcare Federation of Nigeria, Dr. Pamela Ajayi, who has spent a lot of time trying to address the challenges with cancer care and treatment, and to bring together the public and the private sector. So while we wait for that, for the bios to begin to scroll, I'm honored to hand over to Dr. Pamela Ajayi, who, like I said, is the president of the Healthcare Federation of Nigeria. Over to you, ma'am, and thank you very much for joining us.
Thank you very much. Thank you, ladies and gentlemen, for coming on this program. We are indeed honored and very privileged to have you here. I hope you can see me speaking now.
Yes, we can.
Jennifer? Okay,
yes, we can. Confirmed.
Okay, thank you. So I'd like to welcome you all to this very pivotal webinar on unveiling the untapped potential of cancer care in Nigeria. It's an honor for me to serve as your host as we come together today to shine a spotlight on a topic of immense significance. This issue cuts across, everyone. There's no one who hasn't been touched directly or indirectly by the scourge of cancer. And yet cancer remains what you might call an orphan condition, with difficulty for people to get payment for this condition. Now, unfortunately, many HMOs and many insurance policies do not actually cover cancer and cancer care. The Healthcare Federation has actually been a driving force behind, along with very key private sector stakeholders, in advocating for cancer care. We initially started advocating for Cancer Catastrophic Health Fund, which eventually became the Cancer Health Fund. And that has fortunately come into being, and because of the National Institute of Cancer Research and Treatment which also was a body that the HFN and stakeholders lobbied for and worked for back in the day, and which has fortunately come into being. The launch was in July this year. The Cancer Health Fund has an aim and a mission, which is to ease the financial burden of cancer care for the underprivileged in Nigeria. And in a very significant development, the Cancer Health Fund has transitioned from the Ministry of Health to NICRAT, the National Institute of Cancer Research and Treatment. And this is to expand the access to the Cancer Health Fund. And one of the things that I stand here to do is to advocate for the Cancer Health Fund to be made available to the private sector for patients, to enable patients to utilize some of the fantastic and remarkable facilities that we actually have in the private sector in Nigeria. A lot of people are not aware of this. Over $100 million is spent abroad every year on cancer treatment, and we do have excellent facilities at home. Now, I don't want to take any more time. I'd like us to go straight into the work that we are here to do. And the first is to showcase some of our excellent facilities that are here in Nigeria, not just in Lagos. We also have one in Calabar that is also here with us. And we have a short video, which we're going to show now. If I can ask the technical team to put it up and show it now, and to show how Nigeria is, and Nigerian healthcare is making progress in leaps and bounds. So if we can just start with the video showing the national, our national treasures, what I'd call it, in cancer care, and unveil the potential. Thank you very much.
Thank you very much, our dear President, for your excellent opening remarks for this webinar and setting the tone for us. I'm actually looking forward once again to watching that video. Someone who's experienced cancer in the family, I was really enthralled when I saw the availability of services within Nigeria, and I'm sure every single participant is definitely going to enjoy watching this video and seeing that there's significant potential within Nigeria. There are a number of excellent facilities. So I'm sure you're going to enjoy this video as much as I did when I first watched it. So over to the technical team to show the video of 4 stellar facilities that are involved in cancer care in Nigeria, some of the best West Africa. Over to the technical team.
Lakeshore Cancer Center was established in 2014. Several people came together to set up a facility that is completely dedicated to cancer prevention, treatment, and education. Educating other healthcare personnel about the causes, the detection, the treatment of cancer. Letting people be aware that cancer is not a death sentence.
Our staff has always been our strength, reflecting our mission, which is providing compassionate cancer prevention, treatment, and education. We started with about 10 members of staff, evolving to our current staff strength of over 45, both clinical and non-clinical staff.
Lakeshore Cancer Center is the oldest cancer center in Lagos and in fact in Nigeria. So this is the first center that opened as a private center that specializes specifically in cancer care. And over the years, Lakeshore has excelled in this field. Lakeshore is unique because actually, at this point in time, we do not have medical oncology as a specialty in Nigeria. And I have moved to Lakeshore as a medical oncologist trained in the United Kingdom.
Our services cover a wide range of cancer care, including diagnosis with our lab and imaging unit, screening for 4 preventable cancers, surgery, chemotherapy, immunotherapy, palliation, nursing care, GP service, numerous health outreach events, an active mentoring and internship program, as well as an active weekly multidisciplinary tumor board team.
So Lakeshore is unique in that it's not it's the people that make Lakeshore, not building the equipment space, none of that. It's actually our unique set of hardworking, empathic, passionate, and medical and administrative team that have actually made Lakeshore who we are today. They're truly our rock stars, and they're going to help us make Lakeshore what it can be, which is the leading cancer center in West Africa.
Welcome to Asi Upo Comprehensive Cancer Center. We bring hope for cancer patients. Asi Upo Comprehensive Cancer Center is equipped with state-of-the-art facilities to deliver world-class diagnosis and treatment of a wide range of cancers. Welcome to our bunker. This is where radiotherapy treatment takes place. We also have the 90-centimeter large ball Canon CT simulator. It is the largest in West Africa. We have a fully equipped chemotherapy suite, fully equipped theater for oncology surgical cases such as neurosurgery, breast surgery, gynae oncology surgery, colorectal surgery, and many more. Asi Upo Comprehensive Cancer Center is now open. Come one, come all, let's save life. Before we go on this virtual tour, let me tell you a little bit about the hospital. Named after my mother-in-law, Mrs. Marcelle Ruth Odunsi, who died from complications of breast cancer in 1999, the idea of developing the hospital was conceived to bring international standards of care back to Nigeria so that patients can be looked after in an environment closer to home. Our world-class medical facility is equipped with radiotherapy center with variant Trubin linear accelerator.
This is the first in West Africa and of course the first in Nigeria. It's a very accurate machine for treating all kinds of cancer, including stereotactic radiosurgery. So we can do surgical operation using this particular machine. So we're talking about non-invasive surgery of small brain lesions. And we can also treat all sorts of cancers such as the breast, prostate, head and necks, and every other type of cancer that we take. The good thing about this machine is that it's the most accurate machine at the moment, and it's the state of the art.
Imaging center with 64-slice CT simulator, 3D mammogram, 3D ultrasound, and digital X-ray. 2 modular operating theaters. 8-bed day unit infusion and chemotherapy suite. 15 en-suite inpatient rooms. Automated laboratory service and blood bank. In-house oncology and general pharmacy. Our one-stop medical center is designed to make you feel comfortable while providing you and your loved ones with the medical care that you need.
Welcome to the NSIA Youth Cancer Center, NLCC. We are here to support you and your loved ones as you go through this journey. The NSIA Youth Cancer Center is currently the best equipped cancer treatment center in sub-Saharan Africa. We bring decades of joint oncology experience and an unparalleled network of experts from all fields and state-of-the-art equipment to your cancer treatment journey. NLCC commenced its operations on the 29th of May 2019 as a joint venture between NSIA Healthcare Development and Investment Company, NHDIC, and Lagos University Teaching Hospital, Ruth. Every day, our mission is to provide the best standard of cancer care in Africa, harnessing technology, skill, and research.
At NLCC, our vision is to be the leading cancer center in Africa. We provide the best standard of cancer care in Africa, harnessing skill, technology, and research. Our patient-centric team of healthcare practitioners constitute clinical and radiation oncologists, medical physicists, oncology nurses, and therapy radiographers. We provide the best and latest in terms of equipment, team of multidisciplinary professionals delivering the best standard of care to our patients.
At NLCC, our core values are innovation, empathy, excellence, enthusiasm, and collaboration.
At NLCC, with collaboration of our key partners, we deliver the best of cancer care to our patients. Our academic tumor board, with contribution from key specialists from various disciplines, ensures regular review of cases so that we can deliver the best of cancer care to our patients.
At NLCC, our specialists have expansive experience in the treatment of breast cancer, cervical cancer, prostate cancer, ovarian cancer, head and neck cancer, basal cell cancer, sarcomas, leukemia, lymphoma, melanoma, colon cancer, lung cancer.
Thank you very much. And a very warm well done to the technical team. I have a feeling that you had a few technical glitches there, but I guess we get used to, and we did understand a large aspect of that video. And once again, I was taught by the quality of facilities that we have in Nigeria. If you notice, we did the video did talk about some of the facilities that we have within the country are the best in West Africa. And so that is actually a big plus to the teams that have spent time, resources, effort to set this up, either in honor of loved ones, in memory of loved ones, or just to make a difference in the country. So a very big well done to all of the centers. I'm sure we'll be showing that video much later on again in the program, and it will be available on various websites and on the LinkedIn page of the Healthcare Federation of Nigeria. So thank you very much, everyone, and to our over 110 participants who are on this webinar. Thank you for joining us. And we'll now go to the session where we'll be discussing with our esteemed team of panelists. A number of them, you can see them on your screen, and we will be looking forward to their knowledge, what they're going to discuss with us, and some information about access, because I think that's probably a thing that all of us will be interested in, on access, because how will people be able to access these facilities? Because like we said, this is really top-notch, best in class, state of the art. But there sometimes are some issues with access, and we're going to be discussing that at this, because this webinar is about the untapped potential available in a number of these centers. So once again, a warm welcome to everyone. I'd like us to maybe move on a little bit, and then we can go back to issues around cancer and its landscape in Nigeria. And maybe to the president of the National Cancer Society of Nigeria. And also Dr. Tolu, I saw you came on and then you went, but this question is also for you. And what are your views about infrastructure for cancer care in Nigeria? So whoever comes up first. Dr. Tolu, I saw you first, so go ahead. So do you think there's enough infrastructure for cancer care in Nigeria, both private and public, from your own perception?
Thank you so much, Dr. Jennifer, and for having us here. And why it is pertinent to speak about infrastructure, I think we need to look at the cancer space holistically. And there are three key areas to look at it: infrastructure, technology, and human capital. Money can solve the first two, but money cannot solve the third one. And so as we are building capacity, as we are building infrastructure, we must always remember there is a tripod, and the three of them need to be developed. We can cut a check for a cancer center in a day, but it takes 13 years to develop an oncologist. And so we need to look at it holistically. Of course, going by WHO standard, the WHO requires that minimum there should be 1 linear accelerator per 1 million people. Nigeria has a population of 213 million estimate, and with only 10 linear accelerators in the country. So basically we need to look at it, and as we grow in building more infrastructure, we need to match it with appropriate technology and also to develop human capital. And IAEA wants standard says there should be at minimum of 3 therapies to a machine. We should ask the question, how many therapists are in the country? So that's something we need to look at, that when we're talking about the infrastructure, we need to look at not just the hard infrastructure, we also need to look at the soft part of it, which I think is more important. I mean, it goes without saying that we do not have enough of either, but there are centers today that are built in Nigeria that cannot operate because there are no people to work in those places. There's no personnel, there's no human capital. And that's another thing that as NSIA, which we've noted, and we've started a program to train 500 people over the next 3 years in the different, within the entire ecosystem of oncology, from the residents to medical physicists, to the oncology nurses, pharmacists, and the therapists, so that we can, as this infrastructure come on board, as the hard brick and mortar come on board, that there are people actually able to man them. We know today there's a facility commissioned in January. There are 2 linear accelerators in that facility. Not one patient has been able to pass through those 2 machines. So I'm just saying that we should put things in perspective.
Thank you very much, Dr. Tolu. So I saw you spoke about, it's not just about putting the infrastructure in, because that's, like you said, it's about cutting a check, but you're talking about bricks and mortar infrastructure, but it's all about the staffing that are needed to run these sort of very sensitive machines that are required for therapy. But I'd like to ask Dr. Adamu Alhassan, so would you like to weigh in on this from your perspective as the president of the National Cancer Society?
Yes, hello, can you hear me?
Yes, we can.
Okay, very good evening, everyone. Very good evening to all the participants. Very good evening to our former Minister of Health. I cited him in the room, Professor Isaac Adewole, and other distinguished panelists. Dr. Tolu has the infrastructure in Nigeria that has to do with health. Now, healthcare infrastructure generally, it has been in a state of decay for quite some time, not to talk of sophisticated infrastructure for cancer screening, for early detection, and for appropriate treatment of cancer. Now, the bottom line is the fact that Nigeria, just like every other low and middle income country, is one country that is very far from developing primary healthcare infrastructure across the country. Now, when we look at the fact that most cancers are either preventable or treatable when detected early and when treated early. Now, you discover that the major problem we have in Nigeria is the very late presentations of most of these common cancers that are either preventable or curable when detected early. So we have to actually look at the infrastructure at the level of the primary healthcare is very important. Capacity building, as rightly stated by Dr. Tolu, regarding specialists, not only specialists, as ordinary as VIA is the visual inspection by acetic acid for the screening of cervical cancer. Many primary healthcare personnel are not conversant with the speculum examination on how to place the speculum, and hence the training of these healthcare personnel is very important on these basic aspects of early detection modalities. Now, Dr. Tolu has equally mentioned the issue of brain drain, the issue of lack of specialists. In the whole of my state, for example, I come from the northeastern part of Nigeria, there is no single clinic.
Dr. Adamu, I think we've lost you quite significantly. So I know you were speaking about
also be targeted at palliative and other cases of. Okay, so let me just summarize by saying that there is need for a total overhaul of the healthcare system in Nigeria. There is need for a robust primary healthcare development, so that there can be these early screening modalities, health promotion activities at the level of the primary health care. Because if we can pay more attention to prevention and, of course, early detection, we can have significant number of these common cancer cases that can be detected early and hence can be treated. And of course, training and retraining, like what Dr. Tolu has rightly said, can never be overemphasized. You look at radiotherapy machines, for example. How many do we have in Nigeria? I'm sure even with the coming on board of most of these sophisticated cancer centers that I have been to, we can still not boast of more than 10 or 15 radiotherapy machines, as opposed to the 300 radiotherapy machines that should be available for the over 250 million Nigerians. But it's still a good thing for Nigeria, because some African countries don't even have one radiotherapy machine as we speak. Thank you.
Yes, sir. Thank you very much, Dr. Hassan. I think some of what you're speaking about is quite interesting, because you're talking about the primary healthcare level where a lot of these can be detected. And then, of course, how you can take the patients up. And I think what we've seen from the video we have is that there are quite a number of facilities that are actually available for those who are detected at the primary healthcare level to receive services. And I'm sure a number of them may tell you that they do have a fair amount of available utilization, a utilization gap within their facilities that they can happily fill from detected cases of cancer within the country. And so, for example, we've seen that 3 of these centers are in Lagos, 1 is in Calabar. You were speaking of the Northeast, where there's almost no radiotherapy machines. But obviously, these machines exist in these facilities. And so probably something I'd like to ask from each of the partner facilities that we're discussing with here is, and I'll start with Dr. Modupe Elebute-Odunsi, just because she's straight in the center of my screen. And I'd like to ask.
Start with me, I can hear you now.
Oh, okay, great. The DG has arrived. Oh, finally, I actually sent
apologies, the network at my end is something else.
You didn't reply, so I wasn't sure whether you were in. Thank you very much, sir, for joining us. And congratulations on behalf of the Healthcare Federation of Nigeria on your appointment as the Pioneer DG of NICRAT. Our question to you was, what's NICRAT? And there are a lot of people here who may be new to the whole sector and they may be interested in your mandate as the DG and as an institute around cancer research and in Nigeria. So over to you, sir.
All right. So thank you very, very much for the question. The NICRAD is an acronym that stands for the National Institute for Cancer Research and Treatment. It is an agency that was actually established in January 2023. And it was created out of the need for the coordination and multi-sectoral approach to cancer care in the country. You know, before the establishment of the NICRA, there were a lot of activities that have been done in the country in cancer space, but little or no outcome was actually received from all the activities that has been doing. The impact wasn't that great. So it was out of that and the need for the coordination of all the activities that have been going on in the area of cancer space that the Institute was established. I want to recognize the effort made by former minister, that is Prof. Isaac Adewole, who I consider to be like the father of NICRAD, because he was the one that actually pursued the project. He has a passion for cancer, so I have to give him that credit. The Institute has the following mandate. One is to take leadership in the area of cancer prevention, cancer treatment, cancer research in the country. In essence, anything that is cancer in the country, anything that has to do with cancer in the country, it is the responsibility of NICRAD. Vis-a-vis cutting across prevention, cutting across treatment, be it surgery, chemotherapy, radiotherapy, and even the diagnostic aspect of it, be it research, and so on. The Institute has also been mandated to liaise with all the NGOs and other specialists that are working in the area of cancer space to coordinate their activities. The Institute is also charged with the mandate or the responsibilities of setting out policies for cancer control in the country. And we are also charged with the responsibility of assisting the government in the implementation of all the policies that has to do with cancer in the country. So this is just like the 4 out of the 7 or 8 mandates that we have in the country. So you talk about cancer treatment centers that we are currently having very soon, because the sector is new. And that is why we are planning to have an organ that will actually have an oversight as a kind of supervisory role and function on what the cancer centers in the country are doing. And this is not only limited to the public cancer centers. It includes also the private cancer centers in the country, because where we came from, there were no regulatory aspects in terms of nobody knows what the cancer centers in the country are doing. So now NICRAD has that mandate, it has that responsibility to oversee, guide, and support activities in that. So it's kind of a very ambitious mandate that the Institute have. And bearing in mind that we are only like 10 months old now, it's huge, but we are actually pushing hard, reaching out to all the stakeholders necessary to see that we have started making impact. And the impact of the Institute is felt globally. We are happy that HPV, being one of the key vaccines that have been developed, introduced into the country, was launched just like say a week or so ago. It's part of the things that we have pushed. We had series of meeting with the DG of National Primary Healthcare Development Agency and so many other things. Relevant agencies, including the minister in the Federal Ministry of Health. And finally, it was launched. I just want to use this medium to call on. Hello, are you with me?
Go ahead, sir. Please go ahead.
Yeah, to call on you people to kindly assist the country in quashing out the wrong information that has been going out regarding the vaccine, that it has been introduced to actually make our girl child infertile and so many other things. We are planning a lot toward quashing out that erroneous information. But it's suffice to say that we all know what the HPV vaccine does. It is not specific only to cervical cancer. The preventive aspect is not only on cervical cancer, but also it prevents from having anal cancer, vaginal cancer, vulval cancer, penile, and other head and neck cancer. So it's not only for cervical. And for now, we are restricting it to girl child because of the cost of that vaccine and the number of available vials that we have. Subsequently, even the boys are going to start getting. So this is just by the way. I really apologize for joining late because of the poor network, and also apologize for taking your time. I have a very big friend here, Tolu NSIA. I've been looking for a time. I've sent like 3 letters just to meet him, but unfortunately we couldn't meet. So I saw him giving a speech. So Tolu, if you have the time, please, I need to have one-on-one talk with you. Thank you.
HFN, the DG and Dr. Tolu into the same webinar, so you can have an opportunity to show him that he's actually been looking for him for some time. So please, Dr. Tolu, the DG would like to see you. So at the end of this, I'm sure you'll give him a call. Thank you very much. And thank you for also bringing in the issue of the HPV vaccine and its role. We would have spoken about that earlier, so you saved later. So you saved us a little bit of time by speaking about it. So I guess back, and thank you very much, DG. We heard you quite clearly this time, so we hope that your network holds up as we continue with the webinar. So now to Dr. Elebute-Odunsi. So what strategies and initiatives have you put in place? And we've seen the wonderful facilities you have in the video at the Marcelle Cancer Center. So would you like to tell us about that?
Yes, good afternoon. Can you hear me?
Yes, clearly.
Thank you. And thank you very much to Dr. Pamela Ajayi, HFN. I sit on the National Executive Council of HFN, and I'm always amazed by how much work Dr. Ajayi is managing to do across the country and in terms of different aspects of healthcare. Obviously, today we're focusing on cancer. Thank you, Dr. Aniati, for moderating, and good evening to all the participants and all those who have joined. So for me, I have to say that this has been a lifelong dream come true, coming back to Lagos, to Nigeria, having left about 30 odd years ago to go and work in the UK, having finished medical school in Lagos in 1986, and then desperately wanting to train in hematology. And at the time, it was difficult to do that in the country, as I'm sure it is now again. So, these cycles come back. So gone for quite a while and learned quite a lot, and had this vision of coming back. Obviously, my parents have been in healthcare, private healthcare systems in Nigeria for a long time. So I knew what was going on and had helped a bit in the development of those institutions. Coming and setting up Marcelle Ruth primarily was about looking at trying to bring cohesive healthcare for patients, because that's the one thing that was very clear to me over the years, was that if patients presented with a problem, they might end up in a diagnostic center first for their blood tests, and they might end up in another center for their imaging, and then they have to go and see a doctor somewhere else. I mean, completely disjointed. And I think Dr. Adamu had also referred to the fact that because we don't have a comprehensive primary care or secondary care system, which would normally allow for patients to be reminded that they should have all this screening done. You know, all over the world, women will get letters saying they should go and have their mammogram or their ultrasound. Men will be told to go and have their PSAs done. Both sexes will be reminded about colonoscopies after a certain age, depending on what the guidelines is in different parts of the world, or for different ethnic groups. For example, in the US, colonoscopy in Black Americans and Africans has been reduced to from about 35 years old because of some deaths in younger people compared to the normal guidance of over 45 or 50 years old. So that's where primary healthcare would help, but we don't have that happening on a regular basis and in a cohesive manner. So a lot of care, and particularly in cancer, there's a lot of anxiety when a patient presents and they have to go to place A and then B and then C, and getting all that information together, and then, you know, being the anxiety of, is the diagnosis accurate? Because we don't have a lot of some of the tests available and so on. So that's what primarily what we've brought into the system. In the private sector, yes, but working extremely well at international standards. And I would like to invite the DG of NICRA to come and visit. I have one thing I will say is that the stipulations for setting these places up in Nigeria is very stringent. It's not as if you can just get up and come and set it up. And I heard Dr. Adewole saying you can write a check, but I also want to say that, you know, in the public sector, in any country, unless you planned for years, in the countries where these things work, the planning has been done for years. How many centers do you need? Where do you need them? Where are you going to get the money from? And to address what population size? Those are the kind of things that we need to, you know, use this opportunity to do. But at Marcelle Ruth, what we've put in place is a comprehensive center, a one-stop shop, where when a patient presents, within 48 hours, we've done every single test that needs to be done. Some of them we have to send away for, particularly histopathology, which we don't have on site, but we have a fully automated lab. We have all the, you know, the imaging, everything that we need in one place. So the patient doesn't have to go anywhere else. And we can, as a team of specialists, and there are 50 or so clinical staff at Marcelle Ruth, we're very senior led. We've got 4 full-time oncologists, 2 full-time hematologists. We have got a nursing team of about 20 with very senior oncology trained nurses. Same with pharmacy. Everybody has oncology training. We're very specialized and very focused in what we're doing. And because we have all the equipment and all the systems in place, we can diagnose very quickly and we can move straight into treatment. So, and the treatment includes surgery in our 2 modular theaters. This last weekend, we had a patient who had non-invasive brain surgery at our center who's doing extremely well. Today, we've transferred a patient from another part of the country with acute leukemia who's gone straight into treatment, and so on. We're treating children, you know, collaborating with a pediatric oncologist. And so even if you think about the fact, people always think, oh, it's only for people who can afford it, but absolutely that's not correct. Because what we do have in Nigeria is a social sort of insurance where people are supported by family and friends. We also have a lot of people whose family live abroad. So basically by supporting them, they can access care where they would not have accessed care before. So I think, you know, the private sector is playing a big role here, where unfortunately the public sector has not been able to, because with public sector, you have to plan for many years. And I think Dr. Tolu referred to the fact that it takes about 13 years to train an oncologist. I mean, my training was even much longer than that because I did internal medicine before oncology. And so we have to remember that, and that his message was very clear and should be really emphasized upon. And that's where at Marcelle Ruth, apart from us doing our work, we also collaborate with a number of oncologists who are abroad, who join us every single week on Thursday from 4 to 6 p.m. on our tumor board. They've been amazing. They don't ask us for anything. They're all Nigerians. They have different specialties that they look after, breast, head and neck, and so on. So we know, because we present every single new case at those meetings, which gives us the reassurance that we're treating all our patients to international standards. We have a template that we fill in, and the treatment plan goes on from that tumor board. We're also collecting samples from our patients, because it became very clear to me within about 6 months of being back, there is no real data, proper, accurate data. If you want to find out, and we had to look into it when we were trying to set up Marcelle Ruth, how many cancer patients are there? Where are they in the country? What kind of cancers they have? There are about 5 registries in the country, but they're very disparate. And some of them, I've been to every single one of them, you know, and to look at them. Some of them will have accurate data for 2 years and then nothing for about a year because there was no money to collect the information, and then it'll start again. But we have collected data from the very beginning. We know we have seen over 3,000 patients in less than 3 years. We know we have seen over 500 breast cancer patients. We know every single patient, whether they're triple negative or hormone receptor positive. That's where we need to be. We're also collecting blood and saliva from our patients and from those who don't have cancer, because we also have a non-oncology arm to our business. And we formed a biodata bank. This is crucial for us going forward, because this is what's going to give us the information from a genetic point of view. Why are we getting cancers? Why, for example, we seem to see quite a lot of colorectal cancers from the north of Nigeria. We seem to see quite a lot of hepatobiliary liver cancers from the Delta sort of area. We've seen 5 or 6 women who do not smoke, don't live with smokers, who have lung cancers. Why? We need to be able to answer those questions, which will help both the private sector and the public sector plan going forward about who needs to be treated, where the money needs to be, how expensive are these treatments going to be, how are the patients going to survive. So we've got a biodata bank. We've partnered with a group, a genomics company out of Accra. We have our own ethics committee. Next week, we're having training because we're now going to be recognized by the National Ethics Committee so that we can now run our own trials. We've already been approached by 2 big pharma companies and to start doing drug trials. This is huge because when you look at all the information that the pharmaceutical companies are using now to prepare drugs for all cancer patients, they're using data mostly from Caucasians. Less than 1% of the trials are done in Africa. We have now positioned ourselves and are urging other people to do the same, because we need to focus on providing the best treatment, international standards of treatment. And when people always say, oh gosh, but it's expensive, we deserve it. Nigerian patients deserve to be treated to the best standard of care in their own country. At the moment, yes, they access good care, but they have to go outside the country to access it with no support from their relatives, no support from their friends. Cancer treatment takes 9 months, 1 year. They have to leave the country for that length of time. Why should that be? We deserve to treat our patients. We deserve to collect that data. We deserve to be in a position whereby in future, we'll be able to say, this is how we should treat these patients. And when it comes to training, yes, we're totally on it. We already have senior residents from a number of hospitals who are coming to spend time with us. We're having observerships from medical students. We're training medical physicists, we're training therapists, we're training oncology pharmacists and nursing. We're going to make it more formal training in the next year to come. But we're doing all that because we have to do all that. And we will be working very closely with NICRAT and any other bodies to ensure that we all work together to improve the care for our patients, to receive international standards of care in our country.
The Nigerian patient is worth it, and definitely the Nigerian patient is worth all the efforts that are being made by you, Big Show, and the other facilities. And I think this is I'm so excited that the DG is here, because I'm sure he's now thinking that how am I going to direct some of the funding that's under his portfolio from the Cancer Health Fund into allowing poor and indigent patients to access the excellent facilities that exist in a number of our cancer centers in Nigeria. And thank you for coming back. I have I have quite a number of friends out there, so I'm so excited when I see people coming back to give back to society. So thank you. And I'm going to cross the country, cross the River Niger, all the way to Asiukpo Cancer Center. And I'm now going to hand over to Mr. Yegwa Upo to talk a little bit. I'm not going to give you as much time as Dr. Odunsi, but just fire away and let us know what strategies and initiatives are you using. Do you have international partnerships also?
Okay, thank you very much, Doctor, and good evening to all my fellow panelists and Dr. Pamela Jai as well for putting this together and all the participants. So just very quick rundown of Asiukpo Comprehensive Cancer Center. We started operations. We're going to be marking 2 years now. We have one linear accelerator. It's a top-of-the-line Electa Synergy linear accelerator, and then we're about to go live with our brachytherapy later this year. Our staff are just completing training on that. So I would say that those are some of the things that we wanted to be able to put in place in terms of being able to impact cancer care in the country, because in the South region in Nigeria, we didn't have anything really available in the private sector particularly. So we are the pioneer private sector cancer center here in this region. And even right now, as we look at it with regards to things like brachytherapy and even having a linear accelerator, we may even still be the only operational one right now. I just came back from a trip to UBTH in Benin, and it was clear that there was a need for more cancer centers here. So that's those are some of the things that we're being able to put in place to be able to help increase cancer care here. We also set up a Cancer Assist Foundation called the Asiukpo Cancer Assist Foundation, which is supposed to help patients, indigent patients particularly, with accessing treatment. Cost of treatment has always been an issue. Particularly here in the South in Calabar, Cross River, particularly, we have a lot of patients that have come through and they have issues with affording the treatment. So what we have in place with the Cancer Assist Foundation, which we receive donations from different types of donors. We've gotten donors, personal donors, government donors, and so on, is to be able to make this accessible for them. We are also doing quite a bit of work. You asked about foreign partnerships. We've worked with St. Jude's Hospital in the US, in Tennessee, to help us with treatment of some of our pediatric cancer cases. We've had 2 that have successfully undergone treatment. And in fact, we're looking at, okay, hello, can you hear me?
Yes, we can hear you now.
Okay, so sorry. I'm not sure where you lost me, but I was just saying that we're also looking at expanding our partnerships in the coming year. I was really excited to hear what Dr. Odunsi was talking about with regards to being able to get samples, like testing and things done to be able to expand the reach of what's available for patients here in Nigeria. And we've been in talks with a few groups who are also doing that, whether it's with regards to clinical trials or even just looking at sampling for genetic samples of different cancers that we have here. So we are really looking at trying to see how we can expand that reach in the coming year, and also training as well with regards to the oncology training for different parts of oncology. Of course, we have oncologists, medical physicists, and of course medical radiographers here. So that's what we have on ground right now. I hope that should at least give you an overview of what we have in the center. We are also a comprehensive place. It's a one-stop shop. We also have an automated lab. We have, which does quite a lot of the testing that we have for patients when they come in. We also have CT scan, MRI. We do all our mammography. We do dialysis. We have a blood bank here with very sophisticated refrigeration for storing, blood samples and so on, and blood bags, of course, if you need for transfusion. We have a modular theater, operating theater, which of course we can do all the surgeries that we need to be able to do to help support cancer treatments. So it's we really thought about it as this place that you can come to in the South and you can get everything you need done. Just like Dr. Odunsi mentioned earlier, there's a challenge of having people sort of hopping around, doing all the tests and things that they need to do to be able to access their treatment. But once you come in through the doors of Asiukpo, you don't need to leave the premises until you're done with your treatment, because we do chemo, radio, and then of course brachytherapy will soon be online, and so you can get the full gamut of treatments, including surgeries and so on. before you leave.
Excellent. What I find quite interesting also is the possibility of partnerships between the cancer centers and NICRAT around research, because you are collecting samples. Actually, remember I had two friends actually. They were both doctors. They were both from the South, and they both never smoked in their lives and died of lung cancer. So, something is going on, but research isn't being done. And I think, this kind of, we could come together and look at some of the research, some of the stats, and try to address some of the issues that what's going on in our country. And of course, we probably say it's gas flaring or so, but we really need to prove it for policymakers to make a difference. And I think, like I said, the DG is here and probably listening quite closely. So I'm over to Dr. Chinenye Wuji of Lakeshore Cancer Center. Would you like to also talk about, some strategies and initiatives you put in place? DG is here and is available to listen to, some of the real game-changing work that's being done in the private sector for cancer care in Nigeria. So over to you.
Okay. Thank you so much, Dr. Anyanti, for having us today, and to HFN in general and Dr. Ajayi. So yes, I mean, we've had so many interesting videos, and we've been, Dr. Elebute and Mr. Yegwa have been telling us about what's going on in their facilities. And I don't want to go back and repeat a lot of it, because I think we're all trying to make sure that we maintain that same standard of care across our cancer centers. What we found at Lakeshore when we opened in 2014 was that we were trying to look after our patients with, the best cancer care possible, but a lot of our patients were presenting very late. And that made it difficult to offer them care that would really be life-changing or appropriate to them. So what we set out to do in Lakeshore was to help with education. So we're very passionate about education and screening. And we have a foundation that's linked to Lakeshore Cancer Center that helps to screen patients, indigent patients, and really help with education, not just education of lay people, but also education of healthcare professionals. Because even if you have someone that has symptoms, if they go to a healthcare professional that may not be familiar with their kind of cancer or their case, they might not get the appropriate treatment. So Lakeshore Cancer Center has been very passionate about the whole journey, right from screening to education to treatment as well. So we have been doing screening programs, we've been doing education programs. And then the other thing that came out of that was having to do webinars where we would invite you. You asked the question about collaborating with people internationally. We do have international stakeholders that take part in our webinars that take place every quarter. And these webinars really kicked off even more during the COVID times, when it was even more difficult for us to go out and do our screening. We were able to use the webinars to educate people in a time when they weren't able to be going out for these kind of sessions. So as well as that, we are very, very into collaboration at Lakeshore. So we are very keen on making sure that we link up with other members of the other healthcare facilities to ensure that we're offering our patients streamlined care. So for example, we might have other doctors from things like Doctors for Change and other organizations, other hospitals who are referring patients to us. And what we do have is, as Dr. Elebute says, we have a multidisciplinary team meeting where they can present their cases, introduce the patients to us, and we would have a meeting with healthcare professionals, not just based in Nigeria, but also outside the country. This is helpful on both sides because a lot of our doctors outside Nigeria are trying to find ways of contributing to healthcare in Nigeria, and not all of them can move back like Dr. Elebute and myself. And so they want to key into ensuring that our patients are getting the best healthcare. And much as we have excellent oncologists in Nigeria, with the best will in the world, we're forced to cover all specialties when we're practicing oncology in Nigeria. We don't tend to have subspecialization, and that makes it difficult for us to really stay on top of the latest changes. So the collaboration that we have in multidisciplinary team meetings enables us to get the expertise from our colleagues outside the country who are specializing just in breast cancer or just in lung cancer, and give them that experience of working with those of us who are dealing with Nigeria, its peculiarities, the issues of financial constraints that we have here. And that, I think it's a very, very good collaboration we have with our colleagues, both internationally and within the country. As well as that, we also, we talk about cancer care, and one of the things we're really pushing at Lakeshore, particularly now, is palliation and symptom control, because that's something that's often forgotten about in cancer care. Yes, it's very important to have radiotherapy. It's extremely important to have chemotherapy, and we're able to offer that at our facilities. But what happens when a patient is in a situation where they cannot have that active treatment? So we're really trying to push with programs for palliative care, hospice at home, education of both our nurses, but also the families of our patients, and how to deal with their loved ones when they reach that point in their lives where, you know, we can't give them the active treatment. We also are very keen on offering the holistic care, so things like, you know, psychotherapy, religious support, to help diet support as well. So at Lakeshore, we really are trying to look at the 360, the holistic care. So as well as the building, as well as, you know, the drugs, we're trying to make sure that we support our patients throughout the entire journey, like I said, from screening, education, right through to diagnostics, and then end-of-life care as well.
Once again, thanks for coming back. As I always say, the Nigerian patient is worth your coming, so thank you very much. I guess
thank you.
I did discuss with Dr. Pamela about we really need to probably also get on board, maybe not in the next webinar, a number of pharmaceutical companies involved in some of the chemotherapy drugs. Even things as simple as pain drugs are often, you know, beyond the reach for palliative care for quite a lot of clients. And so it's something that we probably really need to talk about, maybe on another webinar another time. I'm jumping now to Dr. Tolulope Adewole. So I hope you're still on the call. The work by the Youth Council or the NLCC, could you tell us, it's a public-private partnership in some way, is it? Would you like to tell us a little bit about that and exactly how it's going and what lessons you've learned along the way?
Thank you very much again. And DG, I just sent you a private chat. Hello, on the question, DG, can you hear me?
Yes, we can hear you.
Okay.
Yes.
That I'm always available, please, and I'll send a private chat that I'm happy to meet with you when I get back to Abuja. Now, to the NLCC, so my disclaimer is, well, let me just put a caveat. I'm not involved in the day-to-day running. I sit on the board of, chair the board of the Cancer Center, but I can tell you a few things. One, and it spans from research and to looking at every aspect. The center has completed 2 international clinical trials. The Areta Cancer Study, in conjunction with the University of Chicago, and I'm sure we all know Professor Fumi Olopade. We finished the Areta 1.0, we're moving to Areta 2.0, and then this thing, and then we've also done the Hypo-African fraction, which is something that is unique and going to revolutionize treatment of prostate cancer in not only in Nigeria but across the world. I mean, to say that the center has attended to over 10,000 unique patients in the last 4 or 5 years, and innumerable publications from research, and that has made us to have observership in any oncologist, medical physical observership status in the best of center from Memorial Sloan Kettering. Right now, we have somebody in Memorial Sloan Kettering in New York. We've got people at MD Anderson, and just name it all over the place in trying to revolutionize cancer care. But one thing that is important that we've tried to do, and what I would say, is to liberalize access. And that is the most important thing, that to liberalize access, and where the bottom of the pyramid can access care. And this is what I've always said, that the life of that woman selling Bolly at Ojuelegba is not different from the life of the governor of Lagos State. They both should have access to the same quality of care. And that is the mantra, and that is the bedrock of what the NSIA Youth Cancer Center is. Now, it is a PPP. Yes, it's formed by the NHDIC. We made the entire cash call of $12.5 million in 1998 to 1999, and then they opened the doors in conjunction with the with the Lagos University Teaching Hospital. I mean, it's got a staff strength of about 100 with 9 or 10 full-time consultant oncologists, and I think maybe about 18 or 10 medical therapists with about 3 linear accelerators, and the first 3 DHDR brachytherapy. But for us, that's not the real success. The real success for us at that center is that we've been able to demonstrate that it is possible. Before the equipment were installed there, all they were saying was that, look, it is not possible to do oncology care in Nigeria, the equipment will not work. But we've demonstrated that. It's close to 5 years now, the equipment are all functioning, running properly. So that's one of them. But the real thing is that we've been able to train and continuously train. And to this, I must give credit to BBGH through their African Access Initiative, who at the beginning of the center, when we started the center with 8 or 9 expatriates because there was just nothing on ground for us to work with. And but today, we've gone from 8 or 9 expatriates to 1. And because we've been able to achieve technology transfer, education, and build capacity of the people, locally trained oncologists, build capacity, have all sorts of exposures, MDTs, and we've got and we are scaling because of that. I mean, this is a center where we see 60 new patients every week. And we're scaling and we're liberalizing access. We're starting another center in Kaduna, in northern part of Nigeria. We're starting another one in the eastern part, and of course, a center in the Federal Capital Territory over the next couple of months. So it's worked well in a way where we have a collaboration. Of course, we had problems at the beginning. First, there was a cultural mismatch of trying to do things between the public sector and the private sector initiative and saying that, look, we have to do it. But over time, with continuous management and carrying everybody along, I mean, so we have to change the entire mindset where we have something on the table. Everybody sits on the table. They not sit with the oncologist on the table, sit with the medical physicist, and we all deliberate on the things of the center. And that has turned it into a teamwork. And at our recently concluded oncology summit, where we brought everybody in the oncology space in Nigeria, in the 11 teaching hospitals that have a residency training program in the oncology space, we brought everybody together so that they can begin to channel and champion a whole new cause. Now, in addition to talking about the poor people, at the bottom of the pyramid, we now have to set up a foundation, which is called the NISP, which is called the NLCC Indigent Support Program. So if that poor woman walks into the facility, she's not going to go out without getting treatment. And so it's gone into the profiling to ensure that, okay, they're actually indigent. So 1% of the revenue of the center every year is nationalized into the treatment of the extreme poor in the society, apart from us actually subsidizing the cost of care for everybody that works in. But it's been a tremendous success, seeing many other centers come up, Marcelle, Asiokpo, and other centers come up after we've demonstrated that this can be done. So kudos. We're hopeful that in another 5 years, that there will be up to 100 or 200 machines and centers in the country, so that there could be equitable access.
Thank you, sir. And I think something I really took from what you
said. So maybe before you go, if you can permit me to.
Yes, sir. It's not going yet, sir. It's not going yet. And I think we're going to arrange, you're going to have to meet Dr. Tolulope Adewole sometime out of this, and I'll ask HFN to make sure they make the arrangement. But one thing I'd just like to say is that I think something that Dr. Tolu said was that whether it's, no matter who the person is, every patient is equal. But however, every patient doesn't have equal access. And I think to be honest, people who have funds, of course, can go to a cancer center. But the government has a key role for those of us who do marketing, segmentation. The government has a key role to ensure that everybody has access and democratizes access to cancer care. And like I said, there are a number of facilities that we've seen here that are available, and the government can support by providing access. So I guess a question back to the DG, and then after that, I'll go back to Dr. Pamela. The DG, there's something called a Cancer Health Fund. How can these great facilities be accessible by people who, to some extent, currently can't afford it, but deserve to have the wonderful care that's available?
Okay, so that is why I thank Tolu for what he just said. It's quite important to know. We're expecting probably more new centers in the country, 7, 10, 20, or probably 100. The Institute needs to know. We want NSIA to actually carry the Institute along in each and every new center that they are going to build. One, for the importance of the human resource that are going to manage the center. And second, the issue of this Cancer Health Fund that we have mentioned, because it's wanting to provide the equipment for the treatment of cancer patients. It's another thing for cancer patient to have access to those things and to have access to that care. Access in the sense that issue of affordability is a very big issue. Now, so that is why we here needs to actually sit and have a discussion with NSIA. Recently, the country, we had a meeting. The country is trying to provide 7 new machines for the country. We have engaged the NSIA. I think we had 1 or 2 meetings. I only attended one. I met with your DG, Tolu, that is Aminu. But the second one, I had to travel to Lagos for legislative dialogue on how to improve cancer financing in the country, which was purely centered around the National Institute for Cancer Research, of which we have in attendance the Senate Committee on Health, the House Committee on Health, all the key senators that we needed. They were there and they assured us that this budget, they are going to ensure that NECRAT had an excellent funding so that the cancer patient will actually, so that we can put a smile to the face of actually this cancer patient. The issue of Cancer Health Fund, it has been, the minister made that proclamation during the International Cancer Week. And the beauty of it is that they are going to transfer, or he has even given the approval for the transfer of Cancer Health Fund to the Institute. Just coming from the Federal Ministry of Health, I had a meeting with the PAMSEC still on how to see the successful transfer of that fund to the Institute. Because we believe there are the bureaucratic bottleneck that is actually affecting each and every sector as the country has bastardized to some extent the disbursement of these funds under the Ministry of Health. We believe we have a better system, a better model that will actually provide the services as at when needed and on time. So we are still in the process of the transfer, and I want to add that during the legislative dialogue, there is an agreement that that fund is going to, the fund that the government is going to put this time around, that is that the counterpart funding is going to double from what we know it.
that they assured to us. And there is going to be another cancer health fund that is meant purely for children. That is a separate budget line for childhood diseases. And I've confirmed from the budget office that they have established that it has started running. Current now, what I'm doing is to pursue the amount has been put so that we have one for the children. We need all the stakeholders to actually rally around and give the NECRAD all the support that it's needed. I think, hello.
Yes, I think Dr. Pamela is going to be looking at me with daggers in her eyes because we have just like 4 minutes left. What I'll probably see that we need to do at the end of this is for you to sit down with the cancer.
Let me just stop here. It's actually going to be a new down with the establishment of NICRAD in the country. We require all your support and patience, and by God's grace, we'll put smile in the faces of all the cancer patients and their relatives. Thank you.
Yes, sir. Thank you very much. And I think, sir, from what I heard from you, there is a fair amount of available resource within the private sector. So rather than us adding on a whole new set of linear accelerators and machines, maybe we should just look for a way in which we can direct some of these patients to these centers and pay for their care. I think that would probably solve a fair amount of some of this challenge. But I hand over now to Dr. Pamela to make some comments. Over to you, ma'am.
Thank you so much. And I want to really appreciate everyone who's been on the call, especially the DG. I think the call has come out and says, please consider the private sector. The work that is being done is tremendous. We've been shown the incredible work that is available. And right now they're here and they're available and they're willing to collaborate and work with the government. And so it's very important that the Cancer Health Fund is made, the patients have the privilege of accessing some of these excellent facilities as well. So and thank you. We know that you are in charge of that now, and we are trusting that you will ensure that that access is made across board, public and private, because the thrust going forward needs to be more of public and private integration, not just public or not just private. Unfortunately, when I heard Dr. Tolu speaking, I heard him saying we call everybody in the cancer space, everybody in the teaching hospitals. Dr. Tolu, you are public and private. Where were the private physicians? Where were the private oncologists there? And this is what this meeting is about. It's also to showcase what is available in the private sector. I also want to recognize the presence of our former Minister of Health, Professor Isaac Adewole, who has been on this call from the beginning. And he says it's an excellent presentation and he wants it to be both across the public and private and all the institutions that are available in the country, so people are more aware of what is going on. So yes, it's so important that we work together and we start forming those bonds and crossing the two and making sure that patients can go from public to private, from private to public, whatever is needed, wherever it is needed, utilizing fertilities, whether they're in Lagos or, as you've heard, we now have facilities in Calabar and the South. Patients need to have to have access to these. So before all of these other facilities are built, why don't we build the bridges across public and private and ensure that patients who need care get the care, and the funds that are available in the Cancer Health Fund, and I'm glad to hear that it's increased, are now available for patients across the board. So I just want to say thank you to everyone. I know that Njide is coming on to actually do the vote of thanks, but I just wanted to appreciate Professor Adewole for his comments as well. Back to you.
Thank you very much, Dr. Pamela. And I think it's been, a really interesting session. I'd like to encourage the panelists. A number of people have put in the Q&A that they would like to contact you. So please, we'll be grateful if you can put in your details, or they can connect to you. HFN, please put in the details. I'll hand over now to Njide, who is the Vice President of Healthcare Federation of Nigeria, for her closing remarks. And I thank everyone for such a wonderful time with us. Thank you. Over to Njide.
Thank you so much. First of all, I myself have been making a lot of notes. It's amazing the kind of work that is going on in our sector. So when Pamela started speaking, I thought she was giving the vote of thanks because she's really said it all. So I want to say thank you, first of all, to Jennifer for moderating this session. To all our distinguished panelists, it is so amazing what I heard today. Normally, when you hear cancer, somebody has cancer, the first thing you do is going into a panic because the impression that we have is that cancer is a death sentence. I am so, I would say, happy to hear the kinds of work that we're doing in cancer within Nigeria. I was fortunate enough to attend the World Oncology Forum in Switzerland about a month ago. And when I was invited, I was like, okay, my whole mandate is UHC. Why are cancer people calling me? Before it was CVD, cardiovascular diseases. So anyway, I went, but it was shocking that a room full of oncologists, scientists, policymakers from Europe were discussing data on Africa. Data from low and middle income countries. And I was the only one who was sitting in that room aside from an oncologist from Kenya, which emphasizes the fact, I think Dr. Odunsi mentioned it, the fact that we need to begin to collect our own data. We need to control our own narrative. We need to make showcase some of the things that we are doing in Nigeria and Africa. I was very happy to announce that HFN had championed the first of its kind in terms of cancer fund for indigents, because as you highlighted, the issue with cancer in Nigeria and in Africa is late diagnosis. So I really want to say thank you very much. We have to find a way to integrate cancer care into our quest for UHC, because right now, it's an orphan child, is on the periphery. Nobody talks about it. It's a disease for the rich people. It's either you have the money to treat it or you go and die, or you find the money to go to India. But I think the narrative obviously is starting to change. So I'm excited. We need to take this discussion forward. Some of the participants have had a lot of questions. So we'll try and find a way to answer those questions and connect you to the panelists. But again, I want to say thank you very much for your knowledge, for your time, for your passion, for what you do. And we will continue this dialogue because I think that it really needs to be carried forward. So again, from Healthcare Federation, our job is to facilitate these kinds of discussions between government and private sector to highlight and showcase what works, what doesn't work, where the issues are, and try to find a way to resolve it. I don't think we're doing too badly. So thank you once again for your time and your knowledge. Over to you, over to myself. I think we've said it all. So have a good evening. Have a good evening.
For being here. Thanks very much, Njide, for your vote of thanks. It's been an exciting discussion, and we're looking forward to even more discussion on our LinkedIn social media channels of HFN. And the discussion continues, especially the discussion with the DG on access by indigent patients to private sector health care, which is available in these centers that have been illustrated today. I think something that Professor Isaac Adelobole said that we really need to take is that we need to update the presentations with cancer centers all over Nigeria, other cancer centers, and ensure that they're actually also on NICRAT website. So I think that's something that we can take forward almost immediately. Thank you very much to our panelists. Thank you everyone for staying the extra 4 minutes that this took. And I look forward to another very interesting webinar organized by HFN. Thank you all and goodbye.